the sun will shine again, and we will live as one, rise as one, stand as one, together as one, we are one. Together we are one. As one, cry as.
And so we start today as one. We are a few minutes behind schedule, but we'll make it up to you. Good morning to you. Welcome to COVID-19 Heroes. And this show is all about those people who've been on the front lines, doing the best they can to try and push back, fight back, if you will, and save people, our frontline people. And sometimes, you know how it is. Even in the fight, sometimes you get so into the fight that you could get bruised here, get battered there, and all of that. And we had promoted that we would have a very, very special hero in the COVID-19 fight on the show this week, all over social media. And this is when we honor that promise. My name is Femi Obong-Daniels. Let me welcome my brother and co-anchor Wiebe Boer to do us the honors. Hello, Wiebe.
Hello, good morning, Femi. So let's jump straight into it today. We have an absolutely special guest today. This is the man on the front line of the front line. This is the hero of heroes, Professor Akin Abayomi, the Honorable Commissioner for Health in Lagos. Thank you so much for being on the show with us this morning.
Thank you very much, and glad to be on the show as well.
So, you know, we were all in shock. I think it was Monday when we all heard, when it was announced that you actually have COVID now. And I guess it's obviously a result of the incredible work that you've been doing and how closely you've been leading this fight. And we assumed, okay, he's going to say he can't do it. But here you are, you know, you keep fighting on. So just, you know, greetings from us and everyone in Lagos who are thinking about how you're doing. But how are you feeling today? And what's your message to us about what you're going through right now?
Thank you very much, Wiebe, and to your other co-host. Can you hear me?
Perfectly.
We can hear you. Go ahead.
Okay. So my voice is a bit hoarse because I have active COVID at the moment, but I'm not that unwell. Okay. I'm slowly getting better. I think you want to know, I think it surprised many people that it has taken me this long to get infected with the virus. Yes, it did surprise me as well. I thought on many occasions that I had contracted it because, you know, there are other things that somebody that had lost their sense, and so I knew that I had been at risk, and therefore I tested, and I was also feeling a little bit under the weather, and it wasn't a surprise that on this occasion I test. You must follow the instructions of non-pharmaceutical intervention, which is social distancing. Be careful where you go. Don't go to places that you don't need to go. Stay away from crowded spaces. And if you're diagnosed with COVID, then isolate yourself because you are then protecting other people in community. And you know, if you're an asymptomatic carrier of the virus and you're wearing a mask, then you are not only protecting yourself, but you're protecting other members of your community. So while we're predicting that Lagos has reached its peak, it doesn't mean it's over. It just means that we're going to start seeing an escalation of new cases, but we're still going to be seeing cases in community, and it may go on for several months until we start to see a decline in the numbers of cases that we're diagnosing on a daily basis. So on that point, I think that's my message to Lagosians. You know, still be cautious. We're not over it yet, but we have to open up the economy as best we can and as cautiously as we can. So that in itself may pose some risks. If you follow the instructions very carefully, all the policy shifts that we're making, then we're quite certain that we will protect Lagosians while at the same time avoiding an economic crisis which has its own implications. Thank you.
All right, we're speaking with Professor Akin Abayomi. Just in case you're just joining us, he joins us via Skype. So yes, there were points in his comments there where it wasn't so clear. That's connectivity issues, but the message got passed out clear and loud. Professor, I want to ask you, and we all wish we had a crystal ball to foresee what is to come. It's over a year now since you became Honorable Commissioner for Health in Lagos State. Could you have imagined that in 2020, the world will be dealing with a pandemic of this magnitude?
So, in Lagos, we are very cognizant of our vulnerability as a mega city, a low-lying metropolis, a coastal city, and an economic hub. The WHO and other organizations have been predicting a pandemic of this nature for the past 5 years. Of course, we experienced Ebola, so we had a little bit of a taste of what it was going to be like. But after we recovered from Ebola, we started to prepare for a threat of this nature as far back as 2015. We started to build infrastructure. The gaps that were exposed during the Ebola outbreak were clearly visible to us. We had gaps in infrastructure. We had gaps in human resources to cope with this kind of eventuality. We had gaps in our diagnostic and treatment capacities. We also had gaps in our ability to conduct research during an outbreak. Research is a very important component of managing an outbreak caused by a novel pathogen or a pathogen that you don't know what it is or how it causes disease. So we were ready in Lagos. I would say we were about 70% ready when we discovered that there was something emerging in China. We watched it very carefully move across the globe. And by the time it got to the Middle East and Europe, we had ramped up our preparedness for this outbreak in Lagos because we knew any moment from now we were going to receive importations of COVID-19. And that's exactly what happened. So in answer to your question, we had been taking the predictions of the WHO very seriously. We recognized early from our experience with Ebola that we would not be ready if we did not ramp up certain infrastructure and capacities in the state. So we had developed what we call a biosecurity readiness and preparedness map. So when COVID came to Lagos, we were in a relative state of readiness, and that was how we were able to contain the outbreak right from the onset. It's very important that you're able to flatten the curve earlier on in this kind of scenario. The reason for that is because you're buying yourself time. And the more time you buy yourself, the more you can put things in place, the more you can study what the outbreak is doing across the world, the more you can tap into research that's happening, the more you can understand how this disease is going to cause illness and maybe even fatality, and put things in place so that you can respond appropriately. It's also important to define the outbreak in your environment. So how the outbreak is behaving in the Northern Hemisphere or in the Americas, as you all know, is very different from how it's behaving in West Africa, Nigeria, and Lagos. So early on in the outbreak, we were able to clearly define the natural history of COVID-19 in Lagos, refine and shift our policies to suit, and divert resources to where they're needed most rather than wasting resources on copycat strategies. So what I mean by copycat strategies is what people have been doing in Europe or America may not necessarily be the right approach in this environment, and it would just be a waste of resources. Where we have limited resources, you have to focus your energy where you are going to get more bang for your buck. So that's the strategy we used right from the beginning. We had the preparedness strategy, we had the early response strategy, we had a lot of data. Lagos responded to this outbreak based on accurate data from multiple sources. So it was a data-driven response. And there, using that kind of data, we're able to always be ahead of the curve, ahead of the outbreak, always anticipating the next event and putting things in place so that we're always able to outsmart the virus and prevent its impact in the community. Thank you.
So Prof, I mean, all what you're saying, let's follow up a bit on that. So if we had not, so two questions here. If you had not done the lockdown, what would it have looked like? And then the second part is, you mentioned, it has had the virus has different behavior in Nigeria, Lagos, and as it did in Europe and so on. Why is it that the numbers are relatively low? And I mean, like you said, Lagos is a mega city, very densely populated. It's an environment that one may have thought this virus would have spread like wildfire and we'd have, bodies in the street, but we haven't seen that. It's so different. And why is that?
Okay, so there are several issues here. First of all, the profile is different, as you rightly pointed out. And we've tried to study this, and we found that, age is a very important component of the natural history of COVID-19. So in Lagos, we have a very young population. Most of the population of Lagos are under the age of 40 in a kind of pyramidal or triangular distribution. Very few people over the age of 50. Majority of people are under the age of 30. So we know that the COVID-19 has a mild profile the younger you are. So that was one thing that was working in our favor. The second thing is that we also know that this virus likes people who have what we describe as the metabolic syndrome. The metabolic syndrome is a combination of hypertension, sugar intolerance or diabetes, and obesity. So if you add that to the age profile of the community, most Nigerians are not, most Lagosians are not obese. They're young. We eat a very natural diet in Lagos. It's a traditional diet. Most Lagosians are lean and not on the obese side. Most of them do not suffer from sugar intolerance. And so when you combine these two factors, then you are going to see the profile that we've seen in Lagos with predominantly mild or asymptomatic disease. Now, this doesn't mean that the virus is not being transmitted. Now, in addition to that, there might be some genetic or environmental factors. So it may be that the people that live in Lagos have some kind of genetic resistance to this virus, or perhaps we've seen relatives of this virus before. So coronavirus, there are thousands of strains of coronavirus. And if you have been exposed to multiple strains of coronavirus, then the immunologist will tell you that you may have what we call cross immunity. Okay. So this is a tropical environment. We are exposed to multiple pathogens on a daily basis. So it's quite possible that we have some environmental factor that is contributing to the resistance. But on that note, I just want to iterate that it doesn't mean that transmission is not happening. We know that transmission is happening, but the profile of the transmission predominantly in the community is asymptomatic to mild, with very few people developing moderate, severe, or critical illness. So that means that the virus is spreading. If you have the virus and you're asymptomatic, you're not going to confine yourself to your home because you don't even know you have the virus. You'll go around your business, you'll go to work, you'll go to social events, and you will be transmitting the virus. So we are seeing active community transmission. What we're not seeing is the rate of complications that we've seen or we've observed in the news, on TV, with thousands of people falling into the severe to critical profile of the disease, requiring intense medical support and ventilatory failure support. So the profile of the disease is different. If we had adopted copycat mechanisms of managing this virus, in our perspective, retrospectively, we believe that lockdown was not effective. simply because of the nature of the environment in Lagos. It's very difficult to lock down a city where majority of the inhabitants of that city depend on a day-to-day income for their survival. If you lock down the city, you're going to replace a public health crisis with an economic crisis. And if you're not careful, you will quickly tip that city into a security situation where there's breakdown of law and order. Thank you.
All right, Honorable Commissioner, I'd like to ask you two quick questions. One is regarding the recent spike in positive cases in Lagos. I want to know if this was expected. And you talked about the relative youth, yes, the youth, the young age of Lagosians. So we think about children of school age. What control measures is the government working on to keep students safe for when schools reopen?
Okay, thank you very much. So yes, what you're seeing with our data on a day-to-day basis is a result of two things. We have decentralized our sampling. We've put sampling stations in every local government area, 57 of them. So we're sampling deep into community. Now, the more you test, the more you'll find. It's a simple equation. It doesn't mean that there is an escalation of the outbreak. If we test 100 people, we'll find 20. If we test 1,000, we'll find 200. If we test 10,000, we'll find 2,000. But what you have to look at is the positivity of the testing. So is there an increasing number of positive cases for every 100? If you don't see that, then your outbreak is slowing down. So what you're seeing is total numbers of cases, but you also have to look at the number of positive cases per 100. And our observation is that we've plateaued. We're also looking at other parameters, like the numbers of people that are succumbing to this infection by dying, and the numbers of people presenting with respiratory failure. And we find that when we look at all those three parameters of positivity rate, numbers of people dying, and numbers of people presenting with complicated multi-organ failure, we see that we feel that we have passed the worst and that we've actually peaked and we are on the plateau. And therefore, over time, as the virus runs out of vulnerable people to infect, then over time we will start to see the downslope and start approaching the end of the outbreak. So our predictions, our modeling predicted exactly what we're seeing. By increasing our testing, we were able to determine more people in community. Doesn't mean the outbreak is increasing. And then we've had a sudden influx of passengers into Lagos, what we call returnees coming in from different parts of the world. We have no control over how people are tested outside of Lagos. So people are getting onto aeroplanes, carrying tests that we have no confidence in. And when they come into Lagos, we test them with our very elaborate testing strategy. And we found on some occasions that as much as 40% of people arriving in Lagos are positive for COVID-19. And that has pushed our numbers up. But we've put things in place to reduce this risk and this threat. Those people that are coming in and are found to be positive are isolated immediately. And we're also putting pressure on international partners, international destinations, that they stick to international standards of testing and that nobody should be allowed on a flight without a valid COVID-19 test. And that test should be conducted in an accredited laboratory where we have confidence in their ability to diagnose COVID-19. Regarding your question around schools, so you have to understand that COVID-19 response is a multidisciplinary response. We have multiple levels of governance, all the way up to the incident commander, who is the governor of Lagos State, Mr. Babajide Sanwo-Olu. And we have what's called a war cabinet. And in that war cabinet, we make very critical decisions. policy shifts based on data. And there are multiple disciplines in the response to COVID-19. Education is one of them. The Ministry of Education are informed by our data, and based on that, are able to make a decision to open the schools and to put appropriate measures in places at the schools, such as good sanitation, distancing in classrooms, and appropriate non-pharmaceutical interventions that would safeguard our children, their teachers, from high transmission of the virus while returning to the school setting. We haven't noticed an increase in transmission at the schools, and therefore our interventions and our decisions to open up the schools hasn't at this point in time created a problem for us.
All right, thanks, Prof. Let me jump in with some additional questions. So you mentioned that a lot of people coming back to Lagos are coming back with COVID. In a couple of days, the international airports are supposed to be fully opened. So what is in place now to kind of manage that influx? Because obviously the numbers will increase substantially.
Yeah, so that's a very important question. As you try to open your economy, you also mustn't put your environment at risk. So we're putting together a very elaborate protocol of testing. It's going to be mandatory that you have a test as part of your permission to board a flight. That test must come from an accreditable lab. You must fill out a health questionnaire. So your passport, your ticket, your questionnaire, and your valid test before you board the flight. In addition, you need to have booked yourself for a test on arrival. So as soon as you arrive in Lagos, you will be given an appointment to go to one of our testing centers where we have developed a lab consortium and we have validated all members of that consortium to make sure that they can conduct an accurate test. On arrival, you'll be given an appointment and you can go to any one of the labs in our consortium and perform a post or an arrival test. And you are supposed to isolate yourself until you get the result of that test. So those are the measures that we're putting in place in collaboration with the Presidential Task Force, the Nigerian Center for Disease Control, and the Ministry of Health at Abuja. We're putting in a very strict protocol to ensure that we are not importing increasing numbers of COVID-19 positive patients into Nigeria, and as far as we are concerned, into Lagos. Thank you.
Well, Sal, you've had private sector participation in COVID care. You've ramped up COVID testing. I wonder what the response has been and how useful that private participation has been. Unfortunately, we've totally run out of time because we are just seconds away from the news. Lagos, because this is very important. We usually do not do this, but I'm going to crave your indulgence because the news is supposed to be on in a few seconds. But this is the big news as affects Lagos, and I'm sure Lagos wants to hear. So on behalf of Nigeria Info, which I represent, and of course I also run, I will crave your indulgence. The news will kick off right after this very important discussion with the Honorable Commissioner. We do hope that you bear with us. So back to you, sir. Tell us about the private sector participation, how useful it has been, and what testing has been for the crisis response so far.
So in a public health response, the onus and responsibility is on government to manage a crisis of this nature. So the governance structure is from the federal down to the state ministries of health and other important ministries, departments and agencies. So the COVID-19 response is managed centrally by the incident commander in Lagos, the governor, and a whole structure of hierarchy of governance all the way down to community. Decisions are made and all management protocols are managed by the government. Now, because of the nature and the expansive manner of this outbreak, we always know and have always known that government alone would not be able to manage the entirety of this outbreak. So we have invited private sector in multiple capacities, both for delivery of care and also for testing. Now, because of the nature of this outbreak, we had to be very careful about how we recruit the private sector into the response. It's a dangerous pathogen, and we have to ensure that the hospital is able, or the lab is able, to manage the case, that you're not putting the staff at risk, and that all samples and data are managed by the state. In addition, we've engaged with private sector specialists in multiple areas where we've pulled in logisticians, strategists, project managers, researchers, and all kinds of disciplines that have helped the government to refine and define its approach. So in terms of private sector participation, we've also received a lot of support from the private sector in terms of cash and kind, construction, expertise, logistics, all manners of contribution to the outbreak through this public-private partnership. What has been very successful has been the care of patients. So some patients didn't want to be managed in the public facilities, even though public facilities are very clean, very comfortable. Some of them even look like hotels. But there is a perception of what government can do. People are always surprised at the caliber of care that we've given our patients, but some people just wanted to be managed in private sector. And so we recruited a number of private sector hospitals that could be trained. We had to alter their infrastructure to make sure it was biosecurity compliant. We had to train their staff, and then we had to make sure that they were ready to manage patients with COVID-19 in a safe way, without putting themselves at risk and without putting other patients at risk that may be patronizing that facility. The same thing with testing. We wanted to escalate our testing. As you know, the more you test, the more you find, the more you'll understand the outbreak in your environment. So apart from the public health laboratories, we recruited private laboratories, make sure they could do the test. We validated their capacity. We trained them in infection prevention control, and then we gave them accreditation to join a laboratory consortium. So we have about 10 laboratories that have joined that consortium, which are able to expand our testing strategy to make sure we can test a lot of people. There are two categories of tests that we do. There's the need to know. In other words, you have symptoms of COVID, we need to test you so that we can manage you. And then there's the other category of want to know. These are people who perhaps want to go back to work, or they want to travel, or out of curiosity, they just want to know what their status is. Now, that's not part of the public health response, and we've allowed the commercial private sector to manage that area. So people that want to know for business or for corporate or opening up the economy are diverted to the private labs, while the people that need to know as part of the public health response are diverted to the public labs, where the test is still conducted absolutely free of charge for those that need to be tested. So that way we've been able to get a very broad bird's eye view of what's going on across the landscape of Lagos. It gives us a lot of information and data, which has helped us to refine and define our policies moving forward. It's been a very successful model, and it has really helped us in getting on top of the situation in Lagos and bringing the situation to a place where we can combine our economic viability with our public health response. Thank you very much.
Well, thank you very much. I think that we're going to have to go off soon, but I just wanted to thank you for what you're doing to keep us safe in Lagos, and just the way that you articulate it and just make it so clear how confident you are in the response and the leadership that you've given. We greatly appreciate that. And we also hope that you recover very quickly. And it's just great to hear from you and to see you even in this time of going through the illness, that you're still providing the leadership we desperately need. So thank you so much for being such a hero.
Thank you very much. And just to the listeners, I hope I recover soon, and I'll be back at the front line in a very short time. Thank you very much.
Well, you didn't
Thank
have
you.
you didn't have to honor this invitation. You didn't have to be here, but you were here nonetheless. You had every right to go under your bed sheet and just cover up for the next 2 weeks. Yes, you've gone on and done everything you've advised of anyone who has had symptoms or anyone who's positive, and you are keeping your distance. You are staying sheltered and away from loved ones to avoid the spread. But you continue to work, and for that, Lagos and the country is eternally grateful. There's much more we would have loved to ask you. We do hope that you will grace us with your presence again, hopefully when you are fully recovered. And then we will look back again and have this conversation. And then we'll probably all share a congratulatory drink and say, thank goodness. In times of despair, in dark days, true heroes emerged without the capes. But these were the heroes, and they were led by no less person than the Honorable Commissioner for Health in Lagos State, Professor Akin Abayomi. Thank you once again.
Thank you for having me. Thank you. Bye-bye.
The show returns next week with Wiebe Boer and I, Femi Obong-Daniels. Do have a lovely, lovely rest of the week. And thank you very much. We apologize. The news went late. It's the very first time we've done it. But that tells you how important this was. Up next is the news at midday. Stay with us on 99.3 Nigeria Info.
Have a viewpoint, an opinion? Do you want to talk? Express yourself right here on 99.3 Nigeria Info. Nigeria Info. From the economic capital of West Africa, this is the news.